So yeah, I agree. I think that, if you're going to go to a course, like, I'm not a dentist, I'm not a doctor, but I still learned a lot, like seeing how you're doing the work, why you're choosing
Sure.
certain cases, why you're not choosing certain cases. And it makes a light bulb go off, right? And I think it would be very helpful when, you have that knowledge that when a patient comes in, they can qualify some patients for you if they see that they're a smoker, a boxer, right? So that was a funny story I had with one of your instructors. So Dr. Ali, and you mentioned you had a patient and you said, are you going to guarantee this implant for life? It's like, well, if your part-time hobby is kickboxing, no, right? But you don't know how to talk to patients about that, right? Because
Yeah.
again, these courses don't prepare you for these conversations. Like, well, what happens
No.
if the patient asks you this? What happens if they're nervous? How do you calm them down, right? It's small things that I think people don't realize how big of an impact that they're going to have on your success. Because like you said, they're nervous. Now you become nervous. They see that you're nervous. They become more nervous as well. The whole thing is just spirals out of
It's
control.
good to, yeah.
And it's like, I think the theory is great. I think from what you mentioned before, any course you go to is going to teach you the fundamental knowledge really well, you know, but it's all of those little things that people take for granted. How do you set up the room? What information do you ask this patient before saying, accepting their case? Like, what are some indicators that this might not go well? They might not really be compliant. They might tell you right now they're going to do all these things, and then in 6 months they're going to come back and they haven't quit smoking. They don't brush their teeth. They don't come in for cleanings. And with when you have enough experience, you can start to spot these people ahead of time. But when you're new and you've only done 3 cases, one on a typodont, one on a pig cadaver, and the other one on your cousin, you don't know how to identify these problems, right? And I think what I liked with the courses you put together is you spent a lot of time talking about all the things that can go wrong and how you start to deal with it and how you prepare for it, and ideally how to avoid it, right? Because that's the best sort of
The goal is to avoid it.
the
Yeah.
goal is to avoid it, right? But not, it's not always avoidable.
Yeah.
But also things like, how do you take photos? How do you get your team to, market these things and show the cases and talk to patients about it? And how do you deal with when the patient's not being compliant? What are some good ways to approach it? What are some cases that look good on paper, but then you realize like, hey, look at these warning signs. This person might have TMJ, TMD, and you didn't check for that. So when they come back later and they say, well, now I'm getting headaches and my jaw hurts, and I think it's because of the clear aligners you did. It's like, well, no, hold on a second. We did this test 6 months ago before we did it, and we identified that you have this problem. We recommended that you treated it. But a new dentist, not knowing that, it's like these are the pitfalls you're going to fall into. Like these are the problems you're going to run into that you're going to have to learn through the hard way from experience, right? So yeah, it'd be ideal if more courses spent a lot more time talking about the business elements, the logistical elements, the communication elements that are all very necessary to succeed with any kind of cosmetic dentistry you try to introduce into a practice.